It's not about one particular project, but I was just given a charge to kind of give an overview of how we do some of the research and some ideas that I can share. So it's basically a very quick talk. And why is research important? For you to do is that each society, country, culture, or a region, they have a unique population and unique population needs. So research from other cultures may not be applicable to our own population. So if you look at all the European studies and Western studies, they may not be applicable. Just like, James gave a great lecture on ankle instability, but if you're not seeing instability, it doesn't matter then, so it has to be relevant. You can help improve the musculoskeletal health of the children by doing research, because research is going to produce or is going to give you more information. You would get significant satisfaction, reputation, possible even money if you're doing research, which is something that the industry is interested in. And you can develop some ability to evaluate research studies. So if you do research yourself, then you'll be able to evaluate the research that is done by someone else. But if you just look at journals, you don't know which is a good article, which article, and I can assure you, no matter what you do for a patient, you would find some support in the literature for that. Doesn't mean that that's the best thing to do. So you should be able to scrutinize the literature and come out with the best available evidence, not any evidence. You can do a closing wedge osteotomy, an opening wedge, a dome osteotomy, and you will find support for each and everything in the literature. But you need to look at the best evidence that's available. So you need to be able to scrutinize the levels of evidence when you're looking at research. And it would come to you if you do research yourself. If you get involved in research, you'll be able to analyze other studies. And nowadays, communication tools are freely available, so it's not even a hindrance. Before, it was difficult to get articles, difficult to look it up online. And then there is strength in numbers. Looking at our population, the number of patients that we have treated just in the last 2 days, 20 surgeries in 2 days, and you see so much of pathology and so many patients that there is strength in numbers. So if you can early on develop at least a little bit of skills and spend some time, it would be great. So one way to approach the research is to identify a topic of interest. Say, for example, a neglected or maltreated lateral condyle fracture. Then you can form a group of physicians who are interested in the same problem. If you're just seeing 1 or 2 in a year, then if you are 10 physicians, you'll have a series of 25. Then you can develop some communication portal like group emails, periodic conference calls, or you can meet at meetings with the colleagues. You can choose who is going to lead the study, and then even form a steering committee or have 5 or 7 members if you have a group of like 20 physicians who are interested. And then you can start with a literature review. You can create a plan or a research proposal. For comparative studies, you would need statistical help, so you need to identify someone who is good in statistics. Say, for example, you have research questions like what are the clinical features of cubitus varus, maybe one question and then classification. So within that subset, so once you get a group of patients with neglected lateral condyle, there are so many questions, and each question may be a publication. Okay, so you can answer different things, that what are the features of cubitus varus, how would you classify it, what are the outcomes of lateral condyle fracture treated with in situ fixation versus in situ fixation and osteotomy. You can do comparative studies, and which patients or factors are related to pain. So you can start asking a lot of questions, but for that you need to have an approach to research. So there are a lot of platforms. Excel is one where you can collect the information and put it in Excel. You can use RadCap, which is free of charge. It is meant for research for patients. And then you can use paper forms. You may have to get permissions. You do data collection, you do analysis, and then you conclude. But this is just a general thing of how we approach research. Just look at this study, adolescent clavicle non-unions. It is very uncommon to have a non-union of clavicle in adolescent. So what was done, this is just published this year. They looked at 9 pediatric hospitals, 18 surgeons, retrospective, and they collected 25 cases of non-union. And then they were able to share the information that what are the risk factors and how did they manage those. So you can do the same thing for non-union of a lateral condyle. Just form a group, collect cases, and you'll get a lot of information. So it's not going to be that difficult. Another approach to multiple research studies is what we have done with the PRISM, which is a Pediatric Research in Sports Medicine Society, where we have formed different groups called RIG, or Research Interest Groups. And you can form such research teams, each for a particular topic, and each physician may be serving on a couple of those teams, and each team has X number of participants. That would be dependent on how many people are interested in doing research. But then you can choose a very broad topic, say, for example, a pediatric femoral shaft fracture. And then the whole research team, you're 10 of you, you all practice in your own location, but every month have a conference call and discuss about pediatric femur fracture, look at the cases, then develop a data set, see what you're interested in looking at, and just carry on. And, if you just start doing something, things would fall in place. So each team can then decide on their specific research questions and develop protocol, data collection, and then conclude. As far as funding, if you're doing retrospective studies, just looking at your cases, there is no need for funding. Okay, but if you're going to do, and all the platforms that we talked about are free of charge. But then if you're going to do prospective studies where you're going to enroll patients in a study area, a lot of centers and a lot of questions, then, we have research coordinators, which are paid positions, and then statistician, if you need statistical help to analyze the data, then you may have to pay someone, because we as orthopedic surgeons are not trained to do statistics. And then if your studies require, say, follow-up MRI on, you want to look at, how the lateral condyle did after 2 years, and you're going to get MRI, that would require funding, because the patient is not going to be able to pay. And you may have to pay the patients. We have some studies where we are paying the patients to come back, because it's important for us to see what happened to that patient. So you incentivize the patient, and you may have to pay the patients, and that has been done. So how do you get the funding? So some of the funding, the physician puts in part of their salary into research, and we also have a research pool where everyone puts in money. No matter how much you make, you put 10% of your salary in research, and that's important. You have satisfied patients who have donated money to do research, and you can, if you have a wealthy patient, you can ask them, if they want to donate, and you can explain them, and there would be patients who would be interested. We can develop a fund within our IFICS team here. The societies can give some funding, the POSI, the Indian Orthopaedic Association. Industry can fund, just like they can fund your conference, they can also fund research studies. And then there are also grants available for countries, so you can use some of those. So the next step, I think, would be to the IFICS team is interested in looking into the research part of it. We are right now into the education mode. We just want to maybe in future do some research. So email IFICS team if you have ideas, suggestions, if you're willing to participate, and we will create a contact list of IFICS research, those who are interested, maybe even create a separate group, and then would like to continue to explore opportunities and try and collaborate. So I'll be happy to collaborate, from where I am, with any of you guys if you're interested, and pool cases together and look at things. And the IFICS team would keep the interested physicians informed about what is going on as far as research is concerned. Thank you.